Welcome to Navigating Hope, your compass to health empowerment. I'm Dr. Jaime Hope, steering you through healthcare, overcoming overwhelm, personal goals, and emergencies. We'll navigate the healthcare maze with actionable insights and real-world advice, unlocking the secrets to a healthier, more vibrant life. Join us to take control of your well-being and make informed decisions for your health and your future. Stay with us as we unravel the mysteries of medicine, wellness, and life's unforeseen challenges, helping you bypass the ER with a dose of knowledge. Stay tuned till the end of the episode with a recap of your actionable insights and a free gift. Let's chart a course to your well-being together. All right, everybody, welcome back to another excellent episode here. I am so excited to introduce my next guest. This is Dr. Hooman Melamed, who is a board-certified orthopedic surgeon, and he's the founder of the Spine Pro. He served as director of the Scoliosis Center at Cedars-Sinai Marina Del Rey Hospital from 2013 to 2021. Renowned for his expertise in spinal health, he specializes in minimally invasive spine surgery and non-surgical treatments. He is dedicated to improving patient outcomes and preventing emergency situations, as you all know, that's near and dear to my heart, through his innovative patient-centered care. He is also a frequent speaker, published researcher, and advocate for public education. Dr. Melamed, it is so lovely. Thank you for being here with us today.
Thank you very much. It's a pleasure to be here.
So let's start with your origin story. I love what you said, that you don't just look at the spine, you look at the entire person who is attached to that spine, which is such a lovely approach. What got you to be passionate about that kind of holistic look at your patients?
You know, when I was in training in my residency, one of my mentors always told me, never be satisfied with the outcome you're getting. And I was like, what do you mean? No, never. It's like, even if you have a good outcome, it's like, no, you need to think about how you can make it better. So you always have to think about, so always, that always stuck with me. And I always thought that about every patient that I saw, even if the patient was happy, I always wonder, could I have done something better? What could I have done to make it better? And, you go through training, medical school, and unfortunately, I mean, as you know, there's not a lot of emphasis on a holistic approach. It's more, everything is like basically organ. There's a heart, there's the liver, there's the extremity, there's your lung, there's your kidney. It's like, I literally remember in medical school, we were sitting here second year, the pulmonologist was talking about the lung, and he said, I don't care about the heart. That's like a secondary. We're just here about the lung. And to me, I feel like we're isolating, but the human body is not isolated. Everything is connected, everything works together. So I always believe, like, what can we do to continue improving? As I said, you went through all of that. I feel like you're like a kind of an assembly line, like a sheep. You're just following what you're told. These are the medications you give to the patients when they have this problem. You just don't question it. You go on, basically. And then, looking at my own health, basically, I thought I was pretty healthy, but it turns out I wasn't. I started getting to this whole functional medicine at a colleague who opened my eye about 11 years ago, 2013, into I was basically pre-diabetic. I had no idea. I was acid reflux, and everybody's like telling me that's how it is, cholesterol getting up. And I thought it was very healthy, and it was in very good shape. And they're like, okay, this is getting older. But what they showed me, my colleague, that no, it's not like that at all. You are what you eat. A lot of it is gut health is very critical. And gut health is very critical to basically everything in your body, in your musculoskeleton, your heart, lung, everything, brain, everything. So we started focusing on my gut health, and lo and behold, that completely changed my life. And I started to implement that. And I figured, we surgeons are too always looking at that specific area of the body we're working on, and we're not looking at the whole body. And I decided that's not good. We need to start incorporating the body. So I started basically looking into, focusing really on gut health, educating patients on nutrition. And most patients are very deficient in supplements. No matter how much organic, vegan, whatever you're eating, you still, unfortunately, our soils are in a way that we don't have all the nutrients in our soil. So we are eating is not giving us everything. So supplements are needed. So we talk about supplements. It's really about optimizing the human body, right? It's optimizing the human body. What can I do to optimize you to heal your spine? If I can optimize your body, I give you a better chance to heal your spine and hopefully avoid surgery. But if you were to need surgery, at least your body is now very, very optimized. And I believe in this whole non-narcotic approach. As I said, focusing on gut health, like fish oil, turmeric, ginger, cayenne pepper, that kind of modalities, multimodality, non-narcotic approach to help the patients. And that's, I started doing that about 13 years ago, and I started attending classes and seminars on functional medicine. And I became very intrigued, and I firsthand saw the massive difference it's made in my patients, not only like recover like without surgery, but if they have surgery, I mean, they tend to recover very, very quickly.
Tell you how refreshing it is to have a conversation with a highly trained surgeon specializing in the spine. And you're talking about things like gut health, the nutrient deficiency in our soil. And even if so, whether a patient does or doesn't ultimately end up needing surgery, you're doing everything you can to optimize their health. So either way, they're going to have the best outcome.
Yes. So what I tell the patients, I said, no surgery is your long-term answer. I said,
Mm.
surgery is helping you, it's helping you to get out of the pain, but it doesn't fix the reason why it happened in the first place most of the time. It's different than if you're in a car accident, you get injured. I'm talking about stuff that happens wear and tear over time. The wear and tear, I mean, by definition, you say wear and tear, it's wear and tear. It's it's how you treated your body over the years. So I tell the patient, I said, look, whatever we do surgery, you don't take care of yourself, you're going to end up causing more problems later on, and this surgery is going to fail, or not as longer lasting. So it's really focusing on lifestyle, their habits. A lot of people getting bad habits, nutrition wise. A lot of people think maybe they're healthy, but they're not. I find out a lot of times people are eating, for example, oats. We know oats are very, very inflammatory potentially. So my job is to educate patients about their lifestyle and allow them to understand that, surgery, we're so used to quick fixes. Surgery is just, okay, I'm going to get you out of the pain, but really the rest of it is up to you, how you want it to turn out.
You really hit on that. That's a huge problem that we're facing in medicine. People want the quick fix. They want the magic wand. And so they'll go to these charlatans who will say, "Oh yeah, I'll do this thing and it'll magically fix all your problems," as opposed to the real people doing the work like you who are saying, "We also need to look at the underlying processes that led to the problem in the first place. Otherwise, you're going to be in the same place that you were before."
That is exactly right. And yes, there are unfortunately some of our colleagues who are quick to recommend surgery right away. You need surgery right away. And they're very good about convincing patients. And it's, that, oh, it's an emergency. If you don't do surgery, you're going to be paralyzed. If you don't do surgery, something bad is going to happen to you. Just a lot of this stuff is honestly is nonsense.
Well, and that's terrifying. So you can see how a patient who doesn't know that would be terrifying. So let's talk about that. So when we were chatting before we hit the record button, sometimes those are the best calls. You talked about doing your due diligence, because just because somebody has doctor on their name tag doesn't necessarily mean that they have not just the expertise. You have to assume some level of training, but you need to know what their practice is like, how many patients they're seeing, what their experience is. So please tell us about how we as healthcare consumers and patients can do our due diligence.
Yeah, as we were discussing earlier prior, the one of the things, unfortunately, I mean, I hate to say it, but doctors are supposed to be very revered by a society, that we are doing the right thing. I mean, I would say that's true for probably a lot of physicians, but it's not true for everybody. Unfortunately, just like we have bad apples in everything, we have police officers. Look at the George Floyd. We know, lawyers, dentists, plumbers, teachers, whatever you call it. Same thing you find in physicians too, that the physicians sometimes do things for their own nefarious reasons. And I think it's important to understand what is that physician is about. And for instance, especially when it comes to spine surgery, you want to make sure you're being treated as an individual person. You're not in some assembly line. It's not a factory. And individualized means, detailed attention. You can sit down, you can talk, they can talk to you about it, not in and out 5-10 minutes. For example, asking, okay, how many patients does the doctor sees in a full day? I know some of my competitors are seeing 60, 70 people a day. I mean, how do you see
It's
60?
hard to get personal with each one of those people.
Exactly. If you're seeing 60 to 70 people, a day from 8 a.m. to, like, let's say 5 p.m., how do you see 60, 70 people? I mean, think about it. And all these new patients, new patients for me we put about a 45 minutes to 60-minute slot because, you got to like go over it. People are worried about their spine health, especially if they need surgery. You got to talk. It takes time. You can't go in and out. And also, one of the things I've learned is in spine surgery, to successful outcome, the number one rule is making the correct diagnosis. I think a lot of times patients are made incorrect diagnosis. They go down the wrong pathway. And this stuff takes time, like sitting down, reviewing the imaging studies. If you're seeing 60, 70 people a day, you cannot sit down and properly pay attention to every patient story in detail. And another question to ask, how many surgeries are they doing? How many surgeries are they doing per week? My mentor used to say, if you're doing 6 or 7, that means you're very busy. And I was like 6 or 7, but now I understand what he meant because, to do a spine surgery properly, like 6 or 7, maybe stretching it to 8, that's all you can really do to sit down, mentally think about it, prepare, really pay attention to that, on that, what I call an individual. If they're doing, 10, 15, 20 surgeries a week, that's a bad sign. If they're doing 8 surgeries a day, that's a bad sign. And then also another question I think is asking about um, what percentage of their cases are what I call implants based, meaning they're putting some kind of an implant in the patient. I can tell you most patients do not need implant-based operation. If you
So
have
what kind of implants are you talking about? Are you talking about hardware? Are you talking about devices? What are we looking at here?
we're talking about rods and screws.
Okay. And you're saying most patients don't need those.
Most patients don't need rods and screws. Fusion operation, most patients don't need that. Now, look, there are exceptions to that. For example, some of my colleagues who are amazing spine surgeon, all they do is they put rods and screws. Why? Because they only specialize in spinal deformity patients, meaning patients who have severe scoliosis, kyphosis, they're hunched over, they're crooked, they had a prior failed surgery, somebody else, they do a lot of those. That's a different story. I'm not talking about that. Those are on the extreme exceptional cases.
Yeah,
And
they
those,
need the rods and screws. That's a
yeah,
specific
all the patients,
population.
but I'm talking in general, patients who have neck pain, low back pain, most patients need some kind of what I call a little roto-rooter, like a little clean out operation done, not multi-level fusion, rods and screws up and down.
And what we were talking about beforehand too, you brought my attention to something I was not aware that was occurring, where surgeons are operating on multiple patients at the same time. Tell me about that.
Correct. That's something nobody even like fathoms, nobody even like, they're like, it doesn't even go to your imagination, it doesn't even go to your head. But there are unfortunately some of our surgeons, colleagues, I should say, who are doing 2 or 3 surgeries at the same time simultaneously. They're bouncing from room to room to room while somebody else is doing the surgery. And they're going room to room. And that's how they can do 8 or 9 surgeries a day.
Right. Because nobody can actually personally do that many surgeries a day. You're saying they're using assistants or other people. So the person who you thought was doing your surgery might not be the one performing a lot of the action. Is that right?
That is correct. Yes. I mean, for example, I remember my dad was having surgery and I was there in the pre-op. It was mornings before 7:30. I was sitting there with him and I saw the surgeon come in next to me with his patient, whatever. And then literally there was this nurses station, big nurses station in the middle here, basically, and diagonally across that, so there was this big wall. He went to the other side when there was another patient there, and they spaced them so far apart from each other. So the two patients don't know that this surgeon is going to be operating on them at the same time. I mean, so these are the questions to ask. How many surgeries are they doing in a day? Are they ever doing more than one room are they ever doing two rooms simultaneously? I mean, surgeons say, yeah, they're going to be there for the critical part of the surgery. But sometimes I tell you, surgery does not work like that. You're doing something takes a little bit longer. Then that patient is all by themselves alone in the other room by somebody else like doing it. And it happens. And I've seen it repeatedly.
Wow. So really to do due diligence, patients need to research their physician and they need to come in with a list of questions.
That is correct. That is correct. If your surgeon I feel like if you're asking a lot of reasonable questions about like the steps of the surgery, about the post-op recovery, I think those are very reasonable questions. About the risk of the surgery, those are reasonable questions. If your surgeon is in hurry, hasty, and as I said, they're looking to the shortcut and just cut you off, I mean, that's not a good sign.
Yeah, that is very red flaggy. Okay. Well, I love that you are so turned off by that approach, and it's really helped shape the hands-on personalized surgeon that you are. Because there's certainly patients expect if they're coming into a spine surgeon that they're going to walk in the door and you just can't wait to slice and dice them. They're like, this person's going to want to cut me open. So say I'm a person right now, like maybe I'm a listener in the audience and I have some back problems. Walk me through what types of problems people come to see you for, and this whole approach that you would take to me as a patient with a back problem.
Most patients end up in my office because of years of what I alluded to about their lifestyle. For example, even a simple act of sleeping. Those who tend to sleep on their stomach, or when you sleep on your side, but your neck is crooked or your spine is curved like that, things like that. Those are, if you think about it, you're in that position. Average people sleep, we're supposed to get 8, but let's say you're sleeping 6 hours, 7 hours. But if you're in the wrong position for 6, 7 hours, your spine, now you imagine that you multiply that every single day, every week, every year, 20 years, 30 years like that. I mean, what do you think is going to happen to your spine? You're going to wear it out. So one is sleep. Second one is your ergonomics. We all go to school, we all went to college, we sit. But then afterwards, once you get into your 20s, you mid-20s, you don't want to spend from 25 to 35, 45, 55 sitting all day at work. That's another thing. So that's another one, 6, 7, 8 hours of people sitting all day. Sitting generates the highest amount of intradiscal pressure. That's why when I'm in surgery, obviously I'm standing, but then when I'm in clinic seeing patients, I'm always alternating between standing and sitting all the time. In fact, a lot of times when I go to patients' rooms, I don't have a sit-down desk that I sit down there. I have this platform basically raised up. And if I need to sit for a second, talk to them face to face, I do that. Then I stand up, I show them. So I'm constantly moving. Movement is good. Think about life is about movement. You move, okay? Well, I hate to use it, but God, when you're dead, I mean, you don't move, right? I mean, so
but you're right, though.
Yeah. So life is about movement. So keep the movement going. And then little things, people don't pay attention. You drop something on the floor, you bend down, you pick it up very quickly. Those sudden bending movements. Now, don't get me wrong. We do yoga, we do stretching, you bend, but those are done on a very controlled fashion. They're not sudden jerky movement. Or in your car, you get something in the back seat, you twist around awkwardly. These little things that they do on a daily basis, or even in the gym, working out in the gym, like you're always bending down to pick up the weight rather than squatting down, paying attention to your form, especially moms out there who are doing laundry, household chores. I see that they're constantly reaching in the crib, reaching down, bending, twisting, laundry, running after the kids, picking up their toys, bending, all these little things, with time, it adds up. So to answer your question, the first and foremost, you want to fix your bad habits. And a lot of people don't think about it. This is not in their head. They're not thinking on a daily basis. These are like ingrained in your head. And as I said, they're bad habits. You're not even aware. You're not even, conscious about it. So look into that. And then of course, nutritionally, is very, very big. Gut health is fantastic in terms of being able to heal the body, lower the inflammation. So when you have an injury, that area is inflamed. Anytime, as you know, in the ER, when there's any type of injury anywhere, even a heart attack, it's an injury, it's an inflammation. The body is trying to react to it. So if you have a lot of inflammation in your body cannot heal your lower back injury the way it should. So you want to lower inflammation by focusing on gut health, what I call an anti-inflammatory diet. Unfortunately, again, a lot of our patients, as you know, a lot of people rushing to Ozempic, Mounjaro, these medications for weight loss, as we know, but these are, they cause muscle loss. They're not just fat loss. You lose muscle, and you can't be on it forever, and you're not really changing your lifestyle. And you're not really changing. And when you stop the medication, for example, you start gaining back, but you're gaining a lot of fat and you've lost that muscle. So you end up in worse shape. So to me, it's all about the lifestyle. You gotta fix your lifestyle. And also don't forget the appropriate supplements. A lot of people, the main supplement that so many people are deficient is vitamin K2. A lot of people are taking now, we know, educated about vitamin D, but vitamin D3 does not work as well without the K2. The K2 is a very important coenzyme that allows the vitamin D3 to work, but most importantly, it helps to push all that calcium into your bone. The vitamin K2 is a very important regulator, and a lot of people are not. In fact, I think it's detrimental. If you're taking vitamin D, your vitamin D level is high. That means you're absorbing a lot of calcium, which is fine, but that calcium is not going into your bone. It's going in all the wrong places, into your brain, heart, kidney, lung, in all the bad places it's going. So vitamin K2 is a very, very important supplement that I want to point out that many people are deficient, and many patients, frankly, are not aware of it, that they need to take. So, there are other supplements too, curcumin, which is the active ingredient in turmeric, a good quality fish oil, I believe in that. A lot of basically holistic anti-inflammatory. And as I said, focusing on the gut health, the leafy vegetables, making sure we get 40 grams of fiber per day. Those are the things I try to emphasize. So to answer your question, yeah, it's a long-winded answer, but I feel like it's not like a one answer. Oh, do this, you're going to be fine. Unfortunately, it doesn't work like that. It's a work in progress. You have to change your lifestyle in order to maximize your recovery from this, the back pain that you came into.
And I love that, because the reality is there is no one quick answer. There's no one quick fix or magic wand. And to me, it's a red flag if you're seeing a surgeon, a physician, or any practitioner that's telling you, oh, yeah, you don't have to change your lifestyle. Just do this one thing and it'll all magically fix. So I love that you shared that with us. I, again, can't tell you how much I appreciate this approach. So you help people with the lifestyle thing, which is really huge. What other modalities, if somebody is in pain, what other options do you give them?
So the lifestyle is very, very important. And I also want to give credit and point out to our other healthcare colleagues that are acupuncturists, are physiotherapists, are chiropractors. I think they play a very, very important role. And there are, some people tell me, oh, I don't believe in chiropractor. They manipulate, and that's not true. Some of the very well educated and the very good chiropractors, they do wonderful. They do wonderful. I've been to them. If they know what they're doing, they know how to treat. There's nothing wrong with trying chiropractors. They can help you. And then physical therapy, but people have to understand sometimes one modality doesn't work. Like, for example, everybody thinks physical therapy, but sometimes physical therapy doesn't work. You have to do acupuncture and chiropractor. So these modalities have to be tried on all the patients. I recommend people, start trying them. And the good ones, usually people can benefit. And usually if you do all of these things that I'm telling you, combination, especially with the lifestyle, 90% chance you're not going to need any surgery. And
That's
if you were,
fantastic. A surgeon trying to not slice and dice people is the most honest thing I've heard in medicine in so long.
well, my motto is the real spine surgeon knows when not to operate.
Mm.
That's my motto on that. So to me, if you can do that, but also, it's bigger than that, because if you were the patient were to need surgery, if you've done all these things that I've just told you, if you been doing the therapy, you've been you really optimizing your body, optimizing your core trunk stability, working on that, guess what? You're going to recover from surgery very quickly. You're going to bounce back very quickly from the surgery, and you're going to have a much better outcome than you thought you're going to have.
So these are the people who have been struggling with pain probably for years, all the people that say, I have back problems, poor posture, neck problems. So if they do get to the point where you need surgery, I love that you recommend versus the old, cut them wide open, do all this manipulation, which takes longer to recover. What options do you have in terms of minimally invasive? And I believe I saw on your site, ultra minimally invasive.
Yes, yes. So when it comes down to the surgery, this is my philosophy is why you go online and people are freaked out about back surgery, spine surgery in general, why there's a lot of, bad outcomes supposedly out there when you read online. It really is scary. When I've actually looked at it, it's like, wow, everything is bad. I'm surprised even patients are coming basically. The problem is I tell you, the first thing I said, got to make the correct diagnosis. The correct diagnosis is number one in spine surgery. And I remember one of my mentors always told me, you got to know the correct diagnosis. Where's the pain exactly coming from? Here's the thing. Just because you see the MRI and the MRI shows all these different things that are wrong, doesn't mean I got to go fix everything. It's not usually like that because as we get older, look, I can tell you once you start MRIing people past the age of 30, everybody's going to have some abnormality. We all have,
Yes.
you've been in the ER, you see CT scan, you see like, patient coming in for something, you get a CT scan, let's say, of the head, whatever, or the accident, you get, oh, wow, the patient has a lot of like degeneration here. They may have arthritis, but so what? They're not symptomatic from it. They have no pain from it. The most important thing is that I call it natural wear and tear. So there's a natural aging phenomenon that happens. That's not painful. It's like a tire of a car. It wears naturally. You don't replace your tire every day, it wears naturally. So the body is like, if you take care of it, it naturally wears, it's going to be okay. So most important thing is look at the imaging, correlate the imaging on that patient. I mean, for example, there are patients I've seen, like I just operated on somebody a couple of weeks ago where if you looked at his MRI, my God, 5 levels in his lower back were just bad. Like everything was just bad. Like it was just the findings. If you read the radiology report, every level was severe this, severe that, this gross finding here, this, that. But most importantly, again, I go back, what is the diagnosis? Treat the patient, not the imaging. Treat the
Mm.
patient, not the imaging. So when I examined the patient carefully, looked at his symptoms was coming from only one side and 2 levels. So one side, 2 levels, that's it. So we're talking about the MRI showed 5 levels, left and right. So we're talking 10 different areas problematic, but I only operated on 2 of the areas out of the 10. And that was enough to get rid of his symptoms. So the most important thing, again, treat the patient, not the imaging. Treat the patient, not the imaging. Make the correct diagnosis. B2, propose the correct surgery. Sometimes the correct diagnosis is made, wrong surgery is recommended. And 3, make sure you do that surgery to perfection. So as I was saying earlier, if you basically going back, if you do all of these 3, correct diagnosis, propose the correct surgery, do it to perfection, that's when you ensure the best outcome in the patient. And assuming the patient has done all these optimization stuff. Now, to most patients, like the gentleman I just told you, he just needed a little rotor-rooter. So most patients, as I was saying, I'm not talking where you have severe spinal deformity, your lungs are getting crushed, all that. I'm talking about most patients like garden variety neck pain, back pain. Most patients need something very, very simple, outpatient, like you go in your rotor-rooter, you clean out with a microscope, or ultra minimally invasive is where you use an endoscope with a camera. Basically, you make 2 little holes like this, 2 little holes the size of the tip here. You make 2 holes. One of them is your camera here, which is going in with the camera you're looking, and the other one is the working portal. So long instruments that are skinny, and they have a little at the tip of it. Basically, you're doing your work there. Basically, so this allows most patients to have, obviously it's muscle sparing. You're not cutting any muscles. You're bypassing all the normal tissue. You're getting down to the pathology. you're doing a roto-rooter, you're cleaning it all out, and it helps with many patients avoid the big surgeries like the fusions. I've been able to save many patients from having been recommended multiple level fusions. For example, I had a guy that came from Oregon who was told he needs a 3-level fusion done. But I ended up doing one level, one side, endoscopic little roto-rooter clean out. Yeah, it took about 2.5 hours, but it was worth it because, he avoided a 3-level fusion. There was another guy from Hawaii recently. So these endoscopic stuff has been a game changer. I'm not trying to toot my own horn, but I was the first one in the United States that started doing this, what I call this biportal, meaning two-portal endoscopic approach back in April of 2019. And the more I've done it, it's been a huge, huge game changer. But I also recommend and warn, there is no such a thing as a nail and hammer. You can't say every patient needs endoscopic surgery, every patient needs microscopic. I always believe, as I've said it before, on my other shows that I've been, I always say you got to propose the correct operation for the patient, even if it's the maximally invasive. But if that's the best correct operation for the patient, then that's what the patient needs. There's some surgeons who say everybody needs minimally invasive. I mean, you can't just do everybody needs this, everybody needs that. I would go through a week, and in 1 week, I would do 5, 6 different, completely different surgeries from each other, because you got to do what's right for every patient. Whether it's
Yeah.
the incision that long, like I did one on Wednesday, for example, an incision that long with a 14-level fusion. It was the
Wow.
revision on a 31-year-old. But you know what? That was the correct surgery for the patient. We did the whole full body optimization before the surgery. We got the patient. The patient really went through the surgery with flying colors, no narcotics after, put on the anti-inflammatory diet. And that was a correct surgery on the patient, rather than trying to do something, much far less invasive.
And that's a huge green flag for me. Even though you love doing minimally invasive, you're not saying everyone needs that. That whole concept, when all you have is a hammer, everything looks like a nail, that's a red flag. So if the physician that, any of our listeners are seeing says, everybody gets the same surgery, that's very worrisome, because each person. So I love that in a given week, you're doing a different surgery on each patient based on what they need.
That's exactly right. Another one that is out there that people have become really looked into is artificial disc replacements, artificial disc, where you're replacing the disc instead of a fusion, the neck or the lower back. And there are unfortunately some surgeons literally, I mean, their whole website is about artificial disc, artificial disc, artificial disc. Everybody's a candidate for artificial disc. Again, that's also very, very scary, because no, that's not true. Again, most patients do not, as I said, need implants, some kind of an implants. You can get away with roto-rooter, but also when it comes to artificial disc, again, I think you have to look at which level, if the patient's a candidate, is causing the problem. A lot of patients are getting 2, 3, 4-level artificial disc, when in reality, they only need like 1 level done, for example, maybe 2 levels, not like 3 or 4 levels done. So if somebody's just telling you all the time, artificial disc, that's another thing to really be concerned about. I love artificial disc. I think they're a phenomenon, but be very, very careful, especially the lower back artificial disc, because the results, even the company admits, the results of the lower back artificial discs are not as good as the cervical artificial discs. And the one thing that many patients don't know is the lower back artificial disc, the revision, when you have to revision, is a complete nightmare. It's almost impossible, very difficult. And if you don't do well, you could have a lifetime of, very, very permanent potential disability. It's got to be done for the right reasons to have the best outcome.
I've seen countless patients in the ER that have had spine surgeries thinking it would fix the problem, but it led to so many downstream problems. They regret having it in the first place.
Yes, unfortunately, I tell the patients that no matter how much pain you're in right now, having the wrong spine surgery, it can make your pain 100 times worse. You wish you were like this than if you had the surgery.
Absolutely. No, I love your episode when you were on the doctors with Dr. Travis. So everybody, by the way, if you haven't taken the time, please go see that. But you talked about ignoring symptoms and window of opportunity to do that. So what are things that people should not ignore, from the regular all the way up to, hey, you need to go straight to the ER right now?
So once in a while, I get a patient that when they come, I'm like, you're going to the ER right now. So I think the most important thing you have to look into when you develop neurologic issues, if you're developing numbness in your hand or arms or legs that are getting worse, or if you're developing, or it could be both, or weakness, you're losing grip strength. Wait a minute, my foot doesn't seem to be you know, moving the way my other foot is moving, or I'm dragging it. I'm dragging my leg. Wait a minute, I can't squat down. Like I can't like sit anymore. Like I don't have the power. If you start developing things that are neurologic, like strength, like you're diminishing strength in an arm or leg part of the body, or in your lower extremities, or you start developing progressive numbness, those are huge red flag signs that you need to do not, you have a small window, because those are considered what we call nerve damage that's happening. If you ignore that, it's like the same thing with a chest pain. If you start having his, chest pain, it's just indigestion. I'm going to be fine. But by the time the patient comes, they have a heart attack, they have permanent heart damages, or stroke, you're getting a headache, something bad is going on, you're ignoring it. It's the same thing. Once you get that, you need to get evaluated right away. And there are patients that when they come in, if they have profound neurologic deficits, they have a lot of weakness. The MRI shows severe compression on the nerve and they have a lot of weakness. Those are the ones you got to jump on it right away, because if you don't, that's it. Once the damage is done, it's not coming back. That's it. You're permanently numb or weak in that area of the body. So those are the category of the patients that those are red flag. If anybody listening, you have those type of symptoms, please do not ignore it. Go see your spine surgeon, and do not always listen to the pain management or your primary care, because they'll tell you, oh, take some aspirin. They don't know how to do proper neurological exams. See a very, very competent spine surgeon, because you may need to have spine surgery. And sometimes I tell patients, sometimes surgery in very, very specific cases as the first line of action is the correct option for the patient. Sometimes telling the patient needs surgery right away is the best treatment for the patient, because if you don't, something bad is going to happen to them. And this is why I hate insurance companies, because patient hasn't done 6 weeks of physical therapy yet. It's like, hello, they don't have time. Like, they have 48 hours, 24 hours to get to this patient. We can't do physical therapy. Somebody who's like, they develop a complete foot drop or a flail foot. They can't squat. They have to walk with a walker because their right knee is buckling from them. Those are the patients you need to jump on them right away. The other thing, other than neurologically, always worries me, and which is pain at nighttime when you're sleeping. I think pain at nighttime that wakes you up always needs to be investigated. Just God forbid, you don't want to miss cancer, or God forbid something else. So that's
Yeah.
another thing to look into it. So those are the things to look into, and those are the things that you should worry you, go to a spine surgeon, get imaging studies done. But for the most part, most patients, again, don't need surgery. Again, don't treat the imaging, treat the patient. Like, I give you an example. I had a patient, a 75-year-old that came into my office. I was the third spine surgeon that she saw. The two other spine surgeons wanted to do a two-level, I think one of them wanted to do a two-level fusion, one wanted to do two-level artificial disc. Why? Because the MRI showed some pressure on the spinal cord. But when I examined the patient clinically, she had a completely normal exam. In fact, all she had for symptom, a little bit of a neck stiffness, sometimes intermittent neck stiffness. That's all she had. So I told her, I'm like, what are you doing here? Go live your life. She's like, what about the MRI? I said, well, what about the MRI? It ain't bothering you. It's not causing a problem. When it does, come back. For now, don't worry about it. Go live your life. And you know what? The patients were torn. Oh, I'm going to get paralyzed. I'm going to get this if I don't do that. That's not true. That's not true. You don't get, I can tell you, most people go on their entire life. They don't even know there's something is wrong in their neck, because these are chronic, slow changes. The body adapts to it, and you're not at the risk you think you are.
Yeah, and those kind of scare tactics are really bothersome because it's for financial gain. Obviously, you make more if you do, 60 surgeries a week or some nonsense on patients, but it's harming them. I mean, I can think of all my years practicing emergency medicine. I have these occasional patients that come in yeah, I had this one gentleman in particular. He injured his back at work. He had been having numbness in his groin and privates area, was all of a sudden losing control of his bowel and bladder. He'd never had that before. This is a young guy in his 30s, but he did go through weeks of physical therapy and people not recognizing, and he ended up having permanent spinal damage. But that's not the majority of cases. Most of even the back pain I see in the ER don't need emergency surgery. They need all of these other lifestyle changes, the modalities, and seeing a competent surgeon to give them the best recommendation.
That is exactly right. And that's why, I used to be in my practice used to be, I'm here in LA. I used to be in a location in Marina del Rey with a other group. And then I didn't like particularly one, I felt some of my other spine surgeon colleague, I felt like too many patients were being told they need surgery right away. They need fusion. Patients are getting surgery within 24 to 48 hours. Like, you got to do surgery. Basically being told you have a 48-hour window that if you don't do surgery, you're going to have permanent pain or weakness. I mean, that is not true. That is not true at all. I can tell you again, unless you're having some serious neurologic issue or numbness, you're not in danger. Do
Yes.
not fall for the fact that you're being told you need emergency surgery. Unless you wake up, let's say your foot doesn't work, your arm doesn't work, like completely is dead, and the MRI shows that something bad, like compression. Sure, you need the surgery. Yes, you need to jump into that surgery. But if you have, let's say, trace weakness, you're not even aware you have the weakness, meaning, when I'm examining your wrist, you're like, oh, okay, yeah, I guess it's a little bit wrist. I didn't realize it. Subtle weaknesses like that, you have time. You can give it about a week or 3 weeks to see if it's going to improve. You don't need to jump into emergency surgery when the patients are being, I mean, unfortunately, I've seen some of my colleagues tell the patient, I mean, literally this word, you have a 48-hour window that if you don't get surgery, you're going to have permanent pain. That is not true. Okay. So please, again, unless you have some progressive numbness, your numbness is getting worse, your weakness is getting worse. Those are the situations. Okay, fine, maybe. But if you're not in that category, do not jump into surgery,
Yeah, we
right
want to
away.
avoid those
Yeah,
predatory
get a
people.
second opinion. Get a
Yes.
second opinion.
And you do see, although you are located in California, you see a lot of patients from out of state because they did their due diligence and they're trying to find a surgeon that they trust. So people will actually drive and fly in to come see you. Isn't that right?
Yes. So, I have about a third of my patients that come from out of town, out of state. Unfortunately, I do a third of my practice also revision surgery, a lot of like revision,
Yes.
unfortunate work that wasn't done. I keep doing it.
Yes, fixing other prior problem surgeries. Well, I know you have some patients waiting. I just have another question
Okay.
here for you, just so people can understand the difference between having a surgery in a hospital versus a surgical center, and what are some of those benefits? Because I think there's a lot of misconceptions out there about that.
I think the some surgeries require hospital stay because you have to stay in the hospital 2 3 nights. You can't stay at a surgery center 2 or 3 nights. The maximum you can stay in any surgery center for now in the United States is 1 night. Now, there are some centers, surgery centers, where they have basically what I call a post-op recovery phase unit, meaning you have to leave the surgery center within 24 hours. That's the max you can stay. As soon as you leave, you go into this other, room down in the same building or a couple of buildings where you get to stay there a couple of more nights. And with nurses, recovery, it's sort of like more of a high-end recovery in this, not so much the hospital surgery center, but more of think about like plastic surgery. Sometimes they send their patients to these what I call these extended recovery places. So those are, but in general, I think a lot of spine surgery can be done as outpatient. They can go to surgery center, and the surgery center sometimes, looking at it, I wouldn't say it's true for all of them, but good surgery centers, they usually have better nursing just because they're better staffed than compared to the hospital, and less chance of infection. And less chances of infection. You get a little bit better care. It's like kind of flying a like business class, if you think about it, or first class versus the coach, if you want to think about it, compared to the hospital, because especially the bigger hospitals, sometimes it's difficult. You don't get that sometimes the personalized attention. So surgery centers sometimes provides a little bit better, but it's not always true. I mean, there are some surgery centers out there, again, they cut corners to maximize profits. I've seen that. So that's another thing to think about. It's not like all surgery centers are perfect. Same thing with hospitals. Some hospitals, I would say, are way better to have your care than the surgery center. The question is, comes down to your surgeon. Really, if you trust your surgeon, you have to trust that the surgeon is going to make the right decision to take you to a facility that surgeon has the trust that they're going to deliver the best care.
Awesome. Oh my gosh, I love that. So everybody stick around after this for your takeaways and your free gift. Dr. Melamed, thank you so much. I know you have patients waiting and you're going to go give them personalized care. He is in his scrubs. He came from the hospital this morning to hop on the podcast to share all of these amazing insights with our listeners. Thank you for the work that you do. Any last words?
Yes, if I may also add, I want to say, first of all, anybody listening to me, I don't want to claim here that I'm the best, I'm perfect. No, I have had my own share of complication. In fact, I remember my mentor told me, in residency, he said, if you don't have complication, that means either A, you're lying or you haven't done enough surgery. So complications happens, but most importantly, if you are basically a patient who unfortunately didn't have the best outcome, most importantly, how's your surgeon reacting to it? I want to know. As soon as I hear, I jump on it. I have no problem admitting to the patient, for example, look, a simple bisectomy where you remove the herniated disc. I've had couple of patients over the recent years where I've done the surgery. Patient woke up same pain. Guess what? I didn't blow them off. I got an MRI right away. I said, I'm sorry, there's still a retained fragment. I got to take you back in. We take care of it. You want to jump into the complication, take care of the patients right away, and be honest with them, be upfront with them. And that's a sign of your surgeon that has empathy, cares, and most importantly, they're transparent. They're being honest with you. There's no shame in if you have to take a patient back to surgery for something you did not intend to happen. But don't blow it off and let the patient be in pain. And this is what I've seen, where the patient could have been handled quickly right then and there, but the patient was blown off. It became a much, much bigger problem later on. And the patient was this agony all this time for no reason.
Yeah, because complications are a normal part of practicing medicine. It's unfortunate. Sometimes they're inevitable for whatever reason, but how your surgeon reacts and how they support you and get you through that process makes all the difference. Oh,
yes. So I hope this was informative.
No, this was wonderful. I know that there are a lot of listeners who have spine problems who are going to have more questions. Where are the best places that they can find you?
My website, thespinepro.com, www.thespinepro.com. And then our general email is info@thespinepro.com. Or general phone number is 424-21-SPINE, area code 424-21-SPINE.
Excellent. And we'll put all that in the show notes for the people who are driving and listening to this. Yeah. It'll all be there available for you. Again, doctor, thank you so much. This was incredibly
Thank you very much. Thank you very much for having me. Thank you very much. Thanks. Okay, take care.
Thank you for tuning in to today's episode of the Navigating Hope podcast. Our guest today was Dr. Hooman Melamed, a renowned orthopedic spine surgeon specializing in minimally invasive spine surgery and holistic health approaches. Let's dive into the 5 key takeaways from this insightful conversation. Number 1, holistic patient-centered care. Dr. Melamed stressed the importance of treating the whole patient, not just the spine. His approach includes focusing on lifestyle, gut health, and anti-inflammatory nutrition to optimize patient outcomes both before and after surgery. Number 2, minimally invasive procedures. Dr. Melamed shared his philosophy of always considering a less invasive procedure before recommending a more invasive surgery. He emphasized that surgery should never be a quick fix, but it's part of a broader, carefully planned recovery process. He prefers techniques like the Roto-Rooter cleanout, which helps the need to avoid larger and more invasive surgeries. Number 3, gut health in healing. Dr. Melamed highlighted the critical role of gut health and an anti-inflammatory diet in healing. By improving gut health through nutrition, patients can reduce inflammation and support their overall health, which contributes to better surgical outcomes. Number 4, red flags in healthcare providers. Dr. Melamed warned against assembly line surgeons who see too many patients and perform too many surgeries in a day. He advised listeners to be cautious of doctors who rush them into surgery without exploring other options or spend minimal time understanding their unique health situation. And number 5, evaluating your surgeon. One of the most important lessons from Dr. Melamed was the importance of doing your due diligence when choosing a surgeon. He recommends asking key questions about the surgeon's experience, the number of surgeries they perform weekly, and their approach to personalized care. To help you find the right healthcare provider, we are offering a free downloadable red flags and green flags, tools for finding and evaluating your healthcare provider for optimal care. This tool will guide you through the process of evaluating your healthcare providers to ensure you get that best care possible. Click the link in the show notes and download your copy today. Remember, whether you're navigating surgery decisions or looking to optimize your health, the key is to stay informed, stay proactive, and keep navigating your journey with hope. Thank you for tuning into Navigating Hope with me, Dr. Jaime Hope. It has been an honor to navigate the realms of health and wellness with you today. Remember, in the journey toward a healthier life, knowledge is your compass. If you enjoyed our time together, please share, like, and subscribe to Navigating Hope. Join us next week where we'll continue to empower your health journey, arming you with the wisdom to navigate life's challenges and keep the emergency room in your rearview mirror.